We're all good? Kia ora, everybody. Welcome to the Social Sustainability Committee meeting number 4. I think something along that sort of line. We'll get underway. Thank you for all community board members turning up. Much appreciated, and councillors. And we'll get on with things. Okay. Council blessing, I shall do that. As we deliberate on the issues before us, we trust that we will reflect positively on the communities we serve. Let us all seek to be effective and just, so that with courage, vision and energy, we provide positive leadership in the spirit of harmony and compassion. Number 3, apologies. We have no apologies received. Does anyone have any apologies they know of at all? Noting that Councillor Kofood is on a leave of absence. No apologies received. Okay. Moving on to item 4, declarations of interest relating to items on the agenda. Do we have any declarations of interest? Going once, going twice. No? Fantastic. Okay. Number 5.
Councillor Spires looks like she's contemplating.
Do I have I don't have a conflict.
No,
in
you
the
don't.
health group.
You're a council appointee. Number 5, public speaking time. We have the chair of the Kāpiti Health Advisory Group, Sandra Daly, and 2 members there as well. Perhaps care to speak would be much appreciated. And just hold on for a moment there, Sandra. Just waiting for some clarity on something, Sandra. Just be a moment.
Sure.
Paintball. Okay, cool. Sandra, please.
Thank you, Martin. I have to say that today is a very special day for Kāpiti Health Advisory Group. After nearly 6 years as a group, we're finally reaching the stage that we have some formal status within the council. And I'm really pleased that Kathy's here to share it, as she chaired us for the first 4 of those years. But we also owe much to Martin, who saw the potential in our team, and at a time when we weren't actually achieving very much, and we were pushing back madly on officials everywhere. But he took a political risk and in betting on us to perform, and we now need to deliver on your faith, Martin. Thank you. The forward-thinking approach that KCDC is taking to health positions Kāpiti well for the future, and it's certainly been noted by many of the health leaders that we are dealing with, so well done to all of you.
Fantastic.
Thank you.
That's great. Thank you for that. And political risk, I don't think there was any risk whatsoever. To me, it was just an absolute no-brainer. Eh? Everything's a political risk. Yeah, that's true. Flying foxes, just saying. But anyway, there'll be 2 parts to KHAG's presentation today, I dare say. There's an issue that you're looking at bringing up now in public speaking, and then we'll be asking you to join the table when we present the paper just a little bit further down the track.
Thank you.
If I could leave that back to you.
Yes. Well, this one's a little bit opportunistic. We promise we won't just drop in ad hoc things in future, but we had a meeting last week with Boyd Swinburne, and we decided it was a very timely opportunity to make a statement from us to you. And that is that we recommend that we note that more than 30% of deaths from preventable diseases in New Zealand arise from factors that Kāpiti Coast District Health has the ability to influence, specifically alcohol, smoking, unhealthy foods and eating habits. We therefore recommend that Kāpiti Coast District Council investigates working with other councils in our region and the Wellington Regional Health Authority to develop a regional strategies, plans and approaches that create an environment where it's easy to say yes to healthy choices, and doing this through a coordinated regional approach. We envisage that this will include local alcohol policies that will provide our communities with some degree of control over where and when alcohol is sold and consumed, smoke-free policies that contribute to less smoking and vaping in public place and education programs that support the above, as well as supporting healthy eating and exercise choices. Thank you.
Thank you for that. And I will acknowledge the anomaly with regards to that. Look, I was at that meeting, and this was something I wanted to bring quite quickly to our committee. I didn't want it to wait longer. There's opportunity there. In relation to this, and I am speaking to this a little bit as well, I think we fundamentally, actually, I'm going to rephrase that, take some advice from council officers. Should I be talking to this now? I would like to capture this as a recommendation from our advisory group, but I can't really speak. Should I be speaking to this now, or should I speak to this when we look at doing a resolution of our own?
I think the agenda item on public speaking time responses would be an appropriate place
Inappropriate.
to speak to that.
Lovely, thank you very much. Advisors, it will be good to speak to this. There are currently at least two committees I know of. There's the Wellington Regional Waste Forum, and there's the Wellington Regional Healthy Homes Forum. A suggestion here is to ask Mayor Holborough to perhaps put this to the Mayoral Forum or another body of some sort to see whether there's an opportunity here with regards to the region working towards health outcomes using the Regional Health Authority as a tool for that. The Regional Health Authority is they don't provide funding, but they provide resources in this space. And the thought was that it would be good to have a regional approach to this. I don't know if it would fly or not, but the advisory group wanted to see whether there was a conversation to be had there as such. Madam Mayor, you look like you've maybe got a question in relation to that.
I'm just reading it. I think, first of all, that Janice was recommending public speaking time responses. Shall we park this until then, or shall we keep going?
Sorry, it's also filling out the process with regards to that. Thank you for
But
that.
I do have a couple of questions about it, so it's
I was
probably
about
good
to
to
say
ask those now.
we can move into questions in regards to this.
Yeah, so just the first one, thank you for bringing it to the table. The local alcohol policies, are you referring to the each council's policies? So one of the paragraphs kind of talks about a regional strategies, plans and approaches, and then the next one seems to dive into local alcohol policies and district or city policies, as the smoking and vaping ones are.
Can I flag that there's been a rewording? The recommendation that we're potentially looking at doing has been wordsmithed as such.
So this isn't the recommendation that we would be looking at?
This is the recommendation that's come from the committee. It's been wordsmithed and I was going to put a just wordsmith version for the committee to then take on board as their recommendation.
So the question remains.
Yes,
if you don't
okay,
mind,
that's no trouble.
are you looking at moving alcohol policies to a region-wide approach, so we already do local alcohol policies. So what do you and smoke-free policies? So what's the change that you're envisaging with that third paragraph?
Um,
Sorry, I'm asking.
Did you want to comment on that, or would you like me to comment? Part of the alcohol policy and the smoke-free policy is they're not bylaws. What they are, it means we have to rely on education to educate our communities in this space. The Wellington Regional Health Authority has the resources from an education perspective as such. The idea is that if we are going to be talking about preventative measures with regards to our communities, should we do it all ad hoc, or do we have a joined up regional approach to an educational program in that space? That was what was behind that.
Cool, thanks. Thank you so much for the work that's gone into this.
Are there any other questions in regards to this? I'm looking everywhere else, but Lawrence.
Over here. Hi.
Yeah, gotcha.
Just a question of clarity for me. Regional Health Authority, is that public health? Regional public health? It is? Okay, great.
Just might need to be. Nigel.
Yeah, so I guess the question is when the more we regionalise, if you nationalise, you tend to lose a regional voice, and if you regionalise, you sometimes lose the local voice. So, how are you envisaging where Kāpiti would fit into that?
Do you like to answer that, Cassandra, or would you like me to? Okay.
We were aware that at this current time you are consulting on both the local alcohol policy, the smoking, vaping policy, and it seemed opportune at this time to suggest that that as an area, a district and a region, we work together because we don't want different messages going out in different places. So I understand the point you're making about a national policy, but I think regionally we could do a lot together.
Yeah. And just to add, look, I know as far as the smoking policy is concerned, there's a national level policy which is going to filter its way all the way down until smoking becomes illegal in about 5 years, I think, whenever that timeline is. But as far as local alcohol policies are concerned, KCDC, we don't have an LAP, which is partly, it's not by neglect, it's partly by design. And Steve McDowell, who's considered a bit of an expert in this field, his advice was not to have one, that in fact there are issues around having a local alcohol policy as opposed to having a series of guidelines, which is probably what you're talking about anyway, and having guidelines that can be region-wide, because different areas will have different policies. And once you have an alcohol policy, that then determines what actions you can take. In some areas, they want them to be far more restrictive, and some they want to be more relaxed. I mean, back in the days when Tawa, for instance, was a dry area, right? So yeah, that's something that council's looked at. And in fact, we should get you a copy of the submission that we made to the Select Committee on the alcohol reform. So yeah, we'll get a copy of that to you as well. Yeah.
Any further questions, anyone? No? Thank you for that. As chair, thank you very much for bringing that to the attention of the table. As chair, I'd like to move a motion in regards to this recommendation that's been slightly wordsmithed as well. I'd like to put it up on the screen. Have a look at it, ask any questions you may have, and then I'd ask for a seconder. I'd also ask the Kāpiti Health Advisory Group committee members to have a nosy as well, and just to see if there's anything that you would disagree with. Happy to take that on board as well. Just trying to check with Nigel. You happy with that around the alcohol policy side of things?
Yeah, it's sorry. Yes, because it's looking at the policy as opposed to having one, a specific policy. So absolutely, we're all in favour of that. The more regional conversations there are, the better that will be. Increasingly as sales go online, so they then become regional. We're actually already starting to see regional delivery of alcohol parcels. I did wonder about the vaping and to what extent local government is empowered to have legislation by way of bylaws around vaping in the absence of a national So we can do that with tobacco, and you can do it to some extent with alcohol as well. But I'm not sure that there is an overriding policy framework that you could build a local government policy around vaping. But that's a question mark. I don't know.
And in relation to that, I think this is more just flagging that we consider vaping an issue, and we're looking for pathways to address it as such, whatever they might look like. Lawrence.
There's just a couple of things that need capitalisation in there. Wellington, for example. And I just, whether we need to actually specify that it is regional public health rather than just regional health authority.
Very easy alteration to make. We need the correct terminology of that organisation. Jackie.
Just a question, would you consider including the Class 4 Gambling Act in there, as it does have a detrimental effect on family incomes and alcohol?
Not at this stage. Reason I say that through me is that this is now a recommendation. As such, this is health. I know from a wellbeing perspective, the gambling aspect could be considered, but we're talking at a regional level with regards to health. That's how I see this. I'm not adverse to upgrading this, but I'd want to find out from the Wellington Regional Public Health whether they are the agency as such to work with this. And I think if we start broadening it out too much, that we lose the kaupapa of what we're trying to achieve from a health perspective.
Specific legislation around the gaming.
Janet.
Yeah, I'm just checking with staff what the implications of this are, because we are recommending a piece of work, and I don't know what's expected from that piece of work.
Chris has indicated she'd like to respond to that.
And whether it sits within the delegation of this committee to do that.
I might try and ask the first part of that question from the Mayor. I would just note that we are engaged with the Wellington Regional Public Health Authority and actually developing the local alcohol policy, smoke-free policy, and we have been talking to them about Class 4 gambling and other things as well. So they're providing support and input into thinking around the development of the health strategy. And so we've also had invites from across the region to participate in some wider conversations around some of these spaces. So the thinking is, with the advice from the from CAG, is very aligned, and I think it nicely supports, I think, where the direction of operational work is heading.
Well, that's fortunate.
Yeah, who knew?
Yeah. So, I would otherwise feel a little uncomfortable about passing recommendations and instructing staff at a subcommittee level with no paper, with no agenda, no paper on the agenda. But if it's aligned in this case with what staff are kind of doing anyway in the direction we're heading, that's okay, I guess. But we are setting a precedent, potentially, which I think is quite a treacherous path to go down. I know that's probably debate, but...
Was there a question in there? Okay. Lawrence.
Sorry, can I ask a further question? Recommendation A specifically outlines alcohol, smoking, unhealthy foods, eating habits. There's nothing down below outside of potential education around food. Should there be something noting that we want to do something in the food space? I have some questions about how much council can influence unhealthy foods and eating habits.
I
Just
think
my personal
Yep, the intent of this is not to...
thought around that.
Yeah, I hear what you're saying. The intent of this is not to put council in a position of having to respond to this on its own. The idea is to talk and see whether there's the option for a regional approach to this. If there's not, that's gone. Now, we can then decide what we want to do in that space, but this is asking for a conversation around a regional approach to this. If, from a regional perspective, there's not a appetite for this, that's the decision that will be made at that level. And then I guess we'll be then looking at how we're going to implement our policies and our strategies in this space. And so it's quite happy to include something in food in there if you think it's required, or it should be flagged if it's going to that level. Or it can be, yeah, open to suggestions with regards to that.
I'll wait until debate to make some comments, I think, probably.
Sorry? Yeah, still need a seconder. I'm going to ask advice from staff again. If we want to look at making an amendment to this, or a slight change now, I'm quite happy to look at that. Quite happy to, in regards to what it is you perhaps think needs to be said there. I dare say once it's moved, that will be a lot harder to do.
Sure, get that.
Yeah, I know.
I guess my question, I can probably throw a question in here is, in light of what Chris has said, that we're already undertaking some work in there, what is the purpose of these recommendations?
I'm sorry. Can you please repeat that?
In light of what Chris has said about the work that is already existing within the council space in these areas, my question is, what is the purpose of these recommendations?
The purpose of this recommendation is to, as I stated before, investigate, and having discussed this, fundamentally the Mayor taking this to either the mayoral forum or other forums that involve a regional approach to whatever, that this be looked at and discussed there with regards to whether there's an interest to do or to approach this from a combined perspective. We're doing it in some other things. What this is doing is, should we say, testing that space to see whether there's an appetite to do a linked up approach at a political level, as such. So, as I said, this might be put forward. It might be put forward as a recommendation from this council to that group, and there might be a process that's required for that. As such, this is, from my perspective, this gets that moving. If it needs to be packaged up in a different way, we could potentially address that if it's required to take it up to that regional level, as such.
Okay. Thank you.
Oh, sorry, still got some more questions. Guy?
Yeah. My question also is, why do we need a recommendation? We're already doing the work. We have an alcohol regime which controls where alcohol can be sold, etc. And also very vague, saying yes to healthy choices. You can spend months talking about that sort of subject. It's very nebulous and vague.
It is.
We don't need this motion, no.
So, if I could respond to that. Our policies are not bylaws. They're education processes. I will pass this to Chris.
Thank you. I thought it might be useful to add that I think the benefit in recommendation B is it points to developing regional strategies, plans, and approaches. We currently are focused on what we're doing as a district, and we are working to develop those at a district level. The work that's been extended into what might be a regional space is, from my perspective anyway, a bit of momentum and there being themes and agreements on some of the challenges we're having at a local level. I think when, just for example, we had been talking about smoke-free space and even vaping, we did have a conversation around the fact that there is some limitations to what we can do at the moment. And the idea is that if we're working together and able to push up some of the collective challenges that we're having, we may be, through other mechanisms, be able to apply a bit more pressure to central government and starting to pick up on making perhaps some stronger changes through some of the direction, be it legislation or other policy statements that are put out in some of these spaces. So I think that would be the additional element of that, which may be something that, for example, the Mayor may talk to her colleagues about in a mayoral forum, or might be the items for discussion that, in addition to what we're doing, would come to this forum in the future.
Jackie.
Thank you. I'm wishing to progress this discussion, and I'm thinking of one issue 10 to 15 years ago, the decision made to site the new Wellington Regional Hospital at the furthest southern end of our region. Anything that I can do, or that this group as a lobby group can do, that legitimately opens the door to a regional conversation about our assets and the ones that the government are going to take future direction in investing in, I think is great. And so on that alone, I am happy to second this recommendation.
Thank you for that seconding, Jackie. Any further questions?
No.
Nigel.
Are we in debate now, are we? I don't have any more questions.
This procedure.
Oh, whoever moved it gets to...
We're in debate. I have right of introduction. I thank the Kāpiti Health Advisory Group for bringing this to the table. The reason why I've supported this is one of the issues I have, if you like, is that councils have been asked to be involved in health. And we've been asked to be involved in health with no funding. It's an issue I'll bring up a little bit further down the meeting. So from my perspective, I would prefer to see ways that we can maximise the ability to spend less, or for council to spend less in this space. And that can be either by asking central government for funding, because my personal opinion, they should be funding in this space. But also we have a regional health authority that's set up to supply support in the education space at their cost. So to me, it seems reasonable to form a partnership, or to explore forming a partnership with this group and approaching it from a regional perspective. Individual councils can then decide how they want to approach it themselves, but we can be resourced through a regional health authority, regional Wellington Public Health Authority as such, barring the fact that we need to move into the education space. We've got issues, we've got big problems here, and everyone looks at everyone else and how they're going to do this, and I've been a very strong believer that we as councils need to be the overarching group that helps bring these conversations together. So I've seen that, and I'm a part of the regional group with regards to waste minimalisation and the healthy homes. I don't know if it's the ideal approach, but there is going to never be one approach in this space. We need to be doing it from multiple fronts, hence why I'm wanting this to be explored. It may come back that we don't go down that pathway, and from a regional perspective, that's still not going to stop us stepping into the space from an education perspective at all. What does that look like? I dare say that would tie into our health strategy and how we approach educating our community in this space. So that's why I've supported this motion coming through, and I hope you will support it as well. Is there anyone else that would like to add to debate? Kathy.
Thank you. I would just like to say that working together regionally makes absolute sense to me. I think it's a really good starting point, and we're working as a region for the same objectives, aims and objectives to curb this. I think it's a really positive move, and yeah, because I think, if young people think, oh, we can't drink here, we'll go into town or something, so it has that, flow-on effect. So it's a really good start.
Janet.
And so thank you for bringing this to the table, even though it is a bit unorthodox. I will have a think about how to introduce this at a regional level. There are various fora. There's the Zone 4 forum, for instance, which might be a good place to discuss this. I know there's a community board, Zone 4 too. There's also the Wellington Regional Leadership Group. And there's also the Merrill Forum. So, yeah, there's certainly opportunities there, and I'll have to think about a good way to progress it, should it even...
Appreciate that.
Yeah,
Thank you.
no matter what happens.
Nigel.
Yeah, what Janet said really, and I don't think that what you do regionally and what you do locally are mutually exclusive propositions. I mean, they can be working together quite well. I should have asked this at question time, so I'll make it rhetorical, I suppose. No, I won't, because I don't know the answer. So is there the equivalent of CAG? That's pronounced correctly now. Yeah. Is there the equivalent in Porirua and Horowhenua? And I apologise for not knowing the answer to that.
No, we met with the Member of Parliament for Porirua earlier this week, actually, and she was really impressed at what we're doing here and said that unfortunately they have nothing remotely like it in Porirua. So you are leading the way in a lot of areas.
Yeah. So I wonder about the value of exporting the model as well, which might be worthwhile. Because one of the things that happens when you get an overlay of either a regional policy or a national policy, very often the local voice gets lost, as I said earlier. And having a group like CAG there, who are ensuring that there is a local voice in the space, right? So again, I think there's synergies between us doing that and someone like Porirua and Horowhenua, who are nearest neighbours. But yeah, to Janet's point, I don't see any reason why this doesn't become a discussion point regionally. But of course, we've got a general election coming up, and goodness knows what's going to happen there. And everybody's juggling at the moment about what's going to happen in the health space and housing and education everywhere. So we live in interesting times.
Thank you, Nigel. I just want to acknowledge Kim, who's online now, who I don't think has her hand up. No. Any other debate? Okay. Moved by Councillor Hudley, seconded by Jackie Elliott. All those in favour? All those against? Passed. Thank you. Thank you very much.
Thank you. And we undertake not to bring anything controversial to you again without notice.
Never say never. And we've got the living wage now at 7.1, and yours will be running up to that. Not if you swap them around. What do you think?
Sorry?
No.
That's up to you. Yeah, you could do that.
Yep. Look, what we might do, since we have the members of the Kāpiti Health Advisory Group here, is swap items 7.2 with 7.1. My apologies, Morag. So that we bring forward the... what am I bringing forward here? It's not on here.
Terms of reference for the Kāpiti Health Advisory
Sorry, the recommendation was on there. Terms of reference for the Kāpiti Health Advisory Group. That would be great. Sorry? No. We're just moving it around, and that sort of stuff. I've got to speak to the paper first. Thanks, Kathy. So, sorry guys, if I can ask you perhaps to come back up to the table. We've just moved the items so that we don't hold you up as such. Bear with us for a second here.
We're still live streaming, but that's okay. It's chivalry. It's fine.
This is Sorka. She's from the Raumati community, the Paikakariki Community Board, just showing that we give everybody equal opportunity at this table. Thank you very much, Lawrence. That's right. I'll pop a gold star on your chart out back.
I'm sorry it's so hard. It should be much easier.
Rightio, 7.2. Health Advisory Group Terms of Reference. If I could hand over to the author of the reports, Gina and Chris, be much appreciated.
Kia ora, thank you very much. As Sandra mentioned earlier, this has been, I suppose, a long time in the making, so we're really happy to have it for you to make a decision on today. I'll take the paper as read, so I'm happy to take any questions and just call your attention to the recommendations that we've got for you to endorse the terms of reference, subject to agreed funding and a work plan, and recommend SOF agree to it, to the terms of reference. Yeah.
I just did want to add that we have developed this terms of reference, obviously, with the Capital Health Advisory Group, and thank them very much for the work that they've undertaken with us over some period of time, actually, but we've landed in a good place, I think. And I just did want to note to the table that we are trying something slightly different with the recommendations today. We had the strategy, operations and finance meeting this morning, and I had said a similar thing about a paper coming from the Climate and Environment Subcommittee. So what we are asking this committee to do today is endorse and then recommend through to strategy, ops and finance, just to give some a little bit more clarity around how that links up. So we'll see how that goes, and you can let us know if that makes it easier or we need to go back to drawing board, but I did just want to note that, so thank you.
And sorry, I'll just add as well, if it is agreed that there will be funding provided, that the Kāpiti Health Advisory Committee will work on a draft proposal for what that funding will look like.
Thank you. Do I have any questions? Guy.
Yeah, can you explain a little bit about the funding that you mentioned? What it'll be for and roughly how much it could be, all those sort of things?
I think maybe I'll refer to the chair to give an indication, the chair of the Health Advisory Committee group, sorry.
Thanks, Gina. We're in the process of developing a work program, and obviously out of that work program will come a budget. At this point in time, it's looking as if it will be mainly around work we do to engage with the community on health issues, the health strategy, and specific issues that may arise. So we currently have a website that needs to be run, and that's less than $150 a month to do that. and there may be meetings or similar, but at this time we don't have that program finalised. We will need to work with council members and with Gina and Chris on that. So we don't envisage it being huge.
From my perspective, I think I would add to that. This group's pretty much will survive on the smell of an oily rag for quite a number of years. I don't perceive the budget requirement for the work program to be excessive, but it will tie into a strategy that we are currently putting a framework around at the moment. So we'll go through a proper budgeting process. I just wanted to note it, as I said before, we'll be pushing for government funding in this space with regards to moving forward. But this whole sector is in so much flux at the moment that trying to get any reasonable answers at anyone is quite difficult. So I dare say, and I stand to be corrected, that we'll wait till things settle after the elections to see who's in charge of what and what that looks like, and then we'll take appropriate steps to follow through on the view that health should be funded through taxation and not rates. That's helpful at all, Guy? Lawrence.
Can I assume that any funding for KHAG that comes out of this would be through existing budgets, or will we be looking at it through a long-term plan?
Let Chris answer that.
Yeah, I may answer that. I think the intention is today to look at the terms of reference, which is really starting to scope the focus that the CAG would be operating around, and then to be able to come back to you with the work program to say, these are the things that we think are the priorities, and to be able to get that done, this is where. And I do need to say, I think we're talking small budget. We're not talking about asking for hundreds of thousands of dollars. This will be small. When that comes to the table, though, I think we'll be looking to provide some further advice to you about actually is this something that we can manage within what we have, or whether it needs to go through the long-term plan is something that we need specific and additional funding for. So we wouldn't be asking you to sign up to the budget until we've had that discussion. I think what we wanted to say to you today, though, is when you're looking at that terms of reference, the work program and what needs to be done, I think CAG members didn't want to sign up to something that they then couldn't deliver. And so that was the signal that was coming through with that recommendation today. Does that help answer your question?
Yeah, that helps, because my follow-up question was going to be, there is a work program that's already on paper in front of us. And is that at risk if there is no funding?
I think what it will be, and I know we'll hand over to Sandra, I see here ready to push your button. I think what it is that work program we have is to give you an indication of where the thinking is at the moment, but we had agreed in the conversations that we'd undertake a bit more work so that we could come back with and this would be in a bit more detail, and this is what it would take. So there's been a lot of work undertaken around that, and Ian also has his hand up, so I might just hand over to you.
Just wait till it goes red, Ian. Up by the microphone here.
Nigel's is on. Yeah.
All right. I think just to give an indication, Lawrence, I think that there's work being undertaken at the moment on a health needs analysis. One of the members of CAG is Jackie Cumming, a professor of health policy at Victoria University, semi-retired, living here. That's all in her own time, and she's building on the information that's out there at the moment and populating it. So that's the there's a certain amount of labour-intensive activity, but that's essentially being done by using some of the expertise that exists around the table to do so. There may come a point in time where we do need that bit extra, but we're not there yet. And I certainly, I do not see external business consultants coming in to do that work.
Amen to that. Nigel. Oh, sorry, Chandra. Just wait till the microphone goes. Yep, you're on now.
I would just stress that we do have some extremely well qualified people on our group who are well used to provide to working on business cases and on big programs, and we have been able to use their expertise at no cost at all. So we're incredibly fortunate.
I just want to add to that I think that's almost an understatement. It's one of the things that's suitably impressed me right from the beginning of my involvement with CAG. Got to get out of that habit with CAG, is the quality of the people around that table and their willingness to do the mahi for our community. Should we say for koha? That was a nice big thank you.
While nobody else is talking, I'll just leap in here then. Yeah, I was just going to emphasise that as well. Sometimes when you're asked to spend a bit of money, it's what value you get. And among this group is a former mayor, a former deputy mayor, a former state services commissioner, a professor of health policy. I mean, you've got a fantastic group of people which actually cost nothing. So resourcing a committee of this ilk to do its work, I think, is just absolutely a no-brainer. It completely makes sense. It's how we manage to then do something with that. I mean, you've got a group that does all of that work. You want to be able to, want to be able to do something with it, make some things happen, right? So it's then how we fit that into the broader policies that we have, both as the discussion we had before, both locally, and given that there isn't a version of you in Porirua, that's a benefit that we can offer to the region. So Kāpiti is a leader in this space, and we can offer the benefits of that to the rest of the region as well. So that's us doing our bit also. So I think, yeah, absolutely brilliant work.
Sure, there's a question in there someplace. Jackie.
Yeah, I was just going to ask, point 15 on membership. I am surprised there is not a appointee from council's elected member group, and just wondering if there's any reason why not, or what the reason was that it was decided not to.
Jackie, that's a fair question.
And
More
I
than
have
a
a
fair
second
question.
question as well. Yep.
If I could have council officers address that.
We think that that's something that probably needs correcting. We do have Kathy on the group as the appointed member, so we will correct that.
Thank you. And point 17, CAHAGWA reports to the Social Sustainability Subcommittee of the Council. I just do wonder if that, even though it notes quarterly reports, whether or not it could be extrapolated a little bit to just state which of those, or how often, or if it's once a year, that a annual financial report be submitted to council. Just the reason being is that council are funding this with public money, and it's just for accountability. So just your thoughts on that, officers?
Yes, if there is a budget that is allocated, we would expect there to be financial reporting. Absolutely.
Okay, so just clarifying, we've captured that there isn't a council officer. There isn't a councillor currently in the terms of reference. That will amend that to include the delegation. It's a delegated authority. Is that correct, Mayor Holborough? We have a delegation to send one councillor to that, which currently is Kathy Spires. So we'll incorporate that into the terms of reference.
Happy to move those recommendations.
I've just got a few questions of my own, if that's okay, Lawrence, but I'll take that as moving. No issues there at all. I have a few questions of my own. Page 15, number 6. Excuse me. Talks to council will not bypass, CAG will not bypass the council when collaborating with stakeholders. Can I just ask for some clarity around that? either from council officers or...
I'm happy to cover that. We've had a good discussion with the group to clarify that we're not trying to prevent them from doing the things that they do best. We really just want to make sure that we're all aligned on what they're doing. So it's there's some indications in that work plan there about some of the engagements that they will undertake, and if other things come up, just to make sure that council and the committee are aware of who they're engaging with.
So that's just more just keeping everyone in touch with everyone else. Are we happy that's not too strong a wording with regards to that?
I think as we've drafted the terms of reference, we've been trying to carefully balance, I'm going to say, refreshing CAG's position in the ecosystem, and just ensuring that we are in supporting the intentions of the health strategy that's going to come out of this. And part of that is the ecosystem and everybody working together. So we think that's an appropriate thing to be putting in to reflect, I think, some of the general conversation that's happening in the health space, and to also recognise that there are aspects of uncertainty underway at the moment around the localities, and CAG as a group and a team have really been focusing on that space. So we're just wanting to make sure that we're all very lined up and CAG supported, as well as us being seen to be really one team as we're engaging in that space. Sandra, did you want to add to that?
Yes, I'd just like to affirm what you were saying. That some of that wording did cause some bristling of hairs around our table. We sat down with Gina and we had a good conversation with her, and we understand quite clearly that we can go and talk to a few people in general, but once we start to talk to big groups or to people who are particularly pivotal, then we need to let you know, and we're happy about that.
Yeah, I'm fine with that. Number 11, page 16. What have I got down here? Reporting-wise, look, to me, this seems like a lot of reporting. Am I wrong in sort of thinking this is a little bit excessive with regards to the reporting in regards to how often our committee meets and the committee meets as such? It seemed like coming back in quarterly, coming back with each meeting we have reporting back to us, and a personal report back quarterly on top of that, I thought was, well, to be honest, I thought it was a bit excessive. As such, that might be the case further on down the track, but I was wondering whether a written quarterly report and an in-person report every 6 months or something, but happy to take guidance on that.
Sure. I mean, I think what we are indicating in that sentence is not actually a huge report. It's more just a short update on progress that's been made.
Mm-hmm.
It's, I think, actually a reduced amount of reporting compared to what the group put up originally. So I think we're happy with it.
And you're happy with that, Sandra?
There's a slight misalignment because we meet monthly and you meet 6 weekly, so we'll need to work something out around that, but otherwise it's fine.
Okay, number 15, just one after that, point 3. It talks to, this is talks to the chair of the subcommittee, and subcommittee is mentioned through here, but I haven't seen any reference to what that subcommittee is. That normally, I think at the beginning of these sorts of documents, you might have the full Social Sustainability Committee, in bracket SSC sort of scenario?
Yes, that is in the background in paragraph 3. It specifies what we mean by subcommittee in the terms of reference.
Lovely,
here.
thank you. Missed that, my apologies. Got that. Jackie, just got tick off the one around council appointment. I had that one as well. Number 21. And where's number 21? We use the term iwi mana whenua in this one, and look, I'm sorry, I've just misplaced my paper. I'm just going to look it up on here. Hold on for a sec. 21. Kāpiti will seek to establish sound relationships with Kāpiti, iwi and mana whenua as may be required above Council's existing relationship and responsibility to engage with iwi and mana whenua. I'd like to replace that with iwi Māori. Saying iwi and mana whenua is a bit of a double up, and the health authority is the Māori Health Authority as such. I would test this with mana whenua, but unfortunately they're not in the room, except for Kim, and I have touched base with this with her as well. It does hark back to some conversations in Te Whakaminanga o Kāpiti raised by the chair around the words used for certain things. I don't want to, my concern is just using the word iwi and mana whenua without Māori in there, is that we limit ourselves to who we can engage with or who we need to seek permission from. And this group is an advisory group as such. We're not a decision body as such. Kim, you care to comment on this?
Kia ora. Yes, same comment really. It would be great if Audrey was in the room because there's a handle on this, but I think it leads us to the point that we really need to, for our own safety, figure out what those terms are going forward, because the terms iwi, Māori, mana whenua, mātāwaka are all embedded in some documents, and there's no consistency. So not saying to make any adjustments at this stage, but just going forward, and I think in all our documents, just noting that we probably need to have that conversation and get some kind of clarity, so that makes us, so that we're all on the same page really, and that everyone that's around the table is safe and we know what words we should be using. That's all.
Thank you for that, Kim. Chris?
Sorry, following Kim's advice, I was going to suggest that perhaps Hara Adams, the GM of iwi Partnerships, might come back with some advice around that, and obviously seek discussion with you and our iwi partners, so that we can land that and put a agreed position on the table. We would then reflect that in the terms of reference and going forward, if that was acceptable.
I'm happy with that, as long as we do that sooner rather than later. Mayor Halber, are you happy with that? Yep, okay. It just starts getting into larger realms of wordings from a general perspective as such. Okay, I'm happy with that. Lawrence, you're happy to move this?
I would move it, but there are some changes to the wording in those recommendations.
There is. How about I move it?
You move it. I'll second.
Okay, thanks. I'd like to move this with some changes to the recommendations. The first one is capturing the actual name of the Kāpiti Health Advisory Group, not committee. If we can make those alterations, it would be much appreciated. What other alterations? That was it?
There were two recommendations where it was incorrectly described as
Okay.
the committee.
No, A, D, C. Anywhere it is, it's got committee instead of group. Yes.
God.
Yep.
Sorry, I'm just looking at 1, 2, 3, 4.
That doesn't make it much better.
It's always good.
We would have 4 opportunities to spot it, but we
Right, yeah. Okay, we good with that? Okay, so moving that with those changes. Do I have a seconder? Thank you, Lawrence. Debate. Right of introduction. This is a long time overdue, and I am humbled, I guess, to be in the position to be able to make this happen. I've seen the frustration over the years and been a part of that frustration with regards to work. And maybe even the timing wasn't right then, who knows. We're in a very good place moving forward, in my opinion. And as has been pointed out by Councillor Wilson, we're going to be ahead of the game with the expertise that's in this group. And I think our community are going to be very, very well served. So I've played a part in bringing this together. But that is what I see our role as councillors, as community leaders, as such, so that we can empower the expertise and the ability for those that want to help our community especially in the areas of expertise, to be able to do that, and for us to be able to, for want of a better way, to capitalise on that mahi, if you like. And we're very fortunate to be in that position as such. So I very much look forward to seeing where this all goes, if this is passed, which I'm hopeful that it will be. But I'll be certainly supporting this as we move forward, and I'm hopeful that you all will as well. Kathy.
Thank you. I would just like to say a big thank you to staff for taking on board and, joining up with the Kāpiti Health Advisory Group. It's been going for a long, long time, and now I can see actually something coming out of it, because it was initially set up, and it still is right for today, to improve access to health services for the people of the Kāpiti Coast, which is actually desperately needed. So I just wanted to say a big, big thank you. And Councillor Halliday is right. There's a lot of expertise now on the health group, which is great. It's just amazing. So, but I just really want to say thank you to staff for a year, and including the health group and the work, and hopefully moving forward we can see it's starting to happen. We're getting more improved access to health services now, starting to move along. So it's great to see. And the ambulance diversion scheme was a biggie for us, and it's still going today. So it's excellent. So, yeah, just a big thank you from me.
Thanks, Kathy. Sophie.
Thanks for the leave to contribute something to
Thank you
debate.
for being here.
I just wanted to say that the times that I have managed to pop along to the Kāpiti Health Advisory Group meetings so far, I'm kind of quite blown away by the breadth of understanding across kind of a different range of health needs and areas of focus that are within the room. And I think that that's only continuing to grow. It's great to see more of a focus on the mental health space, on the kind of rangatahi health outcomes, on the Māori health outcomes. So I guess I encourage the advisory group to continue to build on that kind of depth and breadth of understanding of the needs across the diversity of population. And it's really cool to see how that's kind of expanded over the last year or so. So I just want to acknowledge all of you for your phenomenal work and the many hours that you put in, and probably much of which goes unnoticed, but it's great to see things kind of starting to come to fruition and the connections that you're able to make with key players as well, being great advocates for our local community. So just want to acknowledge you all. Yeah.
Lawrence.
Firstly, thanks to CAG and all the work that they have done and will continue to do. My concern around the finance was to make sure that we are enabling this work to continue in the health space, because I think it is an opportunity that we have in front of us as a community to get the best outcomes we can for our broader health needs and wants within our community. So it's exciting to see this come to this point. Thank you.
Janet.
Yeah, just to talk of the votes of thanks that have been happening around the table. A huge amount of work that Kāpiti Health Advisory Group have done over a long period of time, and I know that these terms of reference have been very carefully considered and very carefully thought through, and been kind of a rock in troubled waters, really, Kāpiti Health Advisory Group. So thank you for the work that you do.
Anyone else care to comment? Sandra.
Could I just draw the committee's attention to the work program, and you'll see that our top priority there has been and probably will be for another couple of years, improvements in terms of a facility. We're calling it an innovative polyclinic in Kāpiti, delivering 24/7 urgent and care. And I'd like to hand over to Ian to just talk a little bit more about what's happening there.
I'll allow that. That's all right.
Oh, I'm right now, and yeah, sorry. I need another 6 meetings before I fully master this. Look, what I wanted to just emphasise is that the way we're approaching this is not to look to structure, but to look at services. If you focus on structures to begin with, you miss the boat and end up stuffing it up. But if you focus on needs, what are the needs, the health needs, then the structures can follow that. So what we've been looking at is the self-obvious really, but the health needs that need to be either improved, expanded or introduced on the coast. And they cover a range of things, but it includes GP access with shortages. It includes urgent care access 24/7. It includes more opportunity to have specialist clinics from currently done in Wellington, done up here. It includes the capacity to further develop even Kenny Peru, to have more things there that may not be done here but could be done there, and that's at least improves proximity. There's a swag of things. It includes more bed capacity than what there is at the moment, for not just for maternity, but maybe some stabilisation, maybe some post-operative treatment of care for patients who are not quite ready to go home. You can't quantify how much that is other than it's quite a lot. So we've been focusing on the site at the moment that is Te Whatu Ora's, used to be the Kaplan Coast DHB's in Paraparumu. And that's got on paper many of the things that we would want, except insufficient capacity. So what we're looking to develop is a compelling, innovative argument that there should be an expanded facility, both starting from the standpoint of what's there at the moment and taking advantage of the fact that there's quite a reasonable amount of land there to expand upon that. But our focus is always going to be on services, not structure. The structure will follow if you can get it. And at some point soon, we're going to have to engage directly with Te Whatu Ora, because if we leave it too late, they're the only, that's the only place in town to do the job, and we need to bring them into the loop and have a sense of ownership of it as we develop it. So at some point, we're going to have to be talking to them about what we're planning to do. We need to develop our arguments more strongly than we've got at the moment, but at some point, sooner rather than later, we need to start that process of engagement. And so I think I can see that as becoming part of the ongoing reporting that goes on about where we're at, not blow by blow, but just at how the direction's going. So I just thought it would be useful just to have that sense of where we are going. Not a hospital on every street corner or an ICU unit in every second street corner, but having the services available in a timely way and comprehensive services at no charge to patients. I should also mention on the facility having the diagnostic wraparound support you need, the radiology and laboratory, that you don't need to traipse into Wellington after having an outpatient clinic or seeing a GP up here. That as well, and obviously telehealth as well, and some of the IT innovations that are around. That's all.
Any other comment? My right of reply? That's why we've got them here. With regards to what was just spoken by Ian there. I'll keep it pretty sweet. With regard, pretty quick from my end. Could you please pass on our thanks to the committee as well? I won't do it via recommendation. If you could just pass on what the comments you heard here, just giving assurance to the committee that it has support, and we look forward to seeing where the journey goes. Ian, from that perspective of what you've just said, I think the table will, over the coming years, get more of an understanding of the health space, what that means in Kāpiti, what that looks like in Kāpiti through those reports, which I'm quite looking forward to as part of an education process as well, as such. So one up, if I could, our motions, A to C, is it? Have been moved and seconded. All those in favour? Any against? That's passed. Thank you very much.
Would you like to do this now?
No, I'll do it again. Do you think it's time for a quick coffee? Yes, of course. Look, I'm going to call coffee break. As such, been a long day already and that sort of stuff, so please refresh. Sorry, Morag. You can join us for coffee out back. Let's help out. There's some nice bickies out there. So be back here at 3 o'clock.